Hello.
Hi, Jacob. Hi.
How are you today?
I'm good, thank you.
And what brings you here?
So I am a prep pharmacist in London and first time at Croi, so very, very excited to be here and just trying to kind of like widen my knowledge around all the kind of new advanced technologies and work that's going around the world. Primarily my focus is HIV prevention, but also STIs, sexual health as well. So that's kind of my special interest.
And how did you get in that field, if you don't mind me asking?
Sure. So I started off as kind of a specialist HIV pharmacist, and then more recently, a couple of years ago, moved to HIV prevention, purely because in my kind of borough in London, which is Lambeth and Southwark, we've got the highest new HIV diagnoses in the country. So the government kind of pushed a bit of money towards how do we tackle HIV prevention and improve our kind of access to PrEP in the local community. So that's how my job was kind of funded. So I moved to that a couple of years ago and loved it ever since.
And what are you looking forward to bringing back to your community that you've learned here?
So just kind of what's happening globally. The NHS is kind of a little bit far behind in terms of like getting drugs available in the UK. So like for example with PrEP we haven't got cabotegravir available yet in England. So learning about kind of how people have implemented that worldwide where it is available, that's kind of what I found most helpful, which I think is kind of the most useful kind of actionable thing I can take back to the UK with me. So yeah, cabotegravir PrEP, learning about the new dapavirine vaginal ring as well has been really interesting. So yeah, the kind of implementation of all these new PrEP drugs has been really interesting.
What do you think? So that last thing that you just mentioned, what do you find interesting in it, and like what you are excited about the further studies?
Definitely. So currently we've only got oral PrEP options available in the UK, so this is going to be the first injectable option. So I think it could really help patients who've got kind of difficulty taking oral tablets, maybe attach a little bit of stigma behind it, and it's a lot more kind of easily to adhere to in a sense that, like, you know, you come in and you have the injection. Obviously you've got to come in for the appointments, but you haven't got to you haven't got to remember to take the tablet every day, if you know what I mean. So I think it could help a lot of people, and if we can get out into the community and kind of target those more hard to reach patients that perhaps aren't able to access sexual health clinics as easily, if we can get out into the community, give them an injection every 2 months, kind of easing the process in terms of them not having to come into sexual health clinics, that would be amazing. So people with no fixed abode, sex workers, Black African heterosexuals, those kind of like marginalised groups, would be amazing, because our general cohort is men who have sex with men, kind of over 90% of our cohort in London, that is kind of predominantly our mix. So if we can broaden our reach wider, that would be amazing.
And if you don't mind me asking, what got you in the field that you're in?
So pharmacy was a bit of a kind of I don't really know how I got onto that, to be honest.
What inspired you?
I just kind of originally I thought, I'll be like the first one to develop like a new, cure for cancer or something, and then I quickly realized definitely not intelligent enough for that. So went into kind of did the pharmacy degree, went into kind of hospital pharmacy, and found that super interesting and just really rewarding. Like, you generally feel like at the end of the day that you've made a difference, and you can't really take that away. So yeah, that's it really.
Thinking about others, not just yourself. That's beautiful.
Yes, yeah.
Sure.
Cringy, but that is what it comes down to. Yeah.
And what is one topic that you're really listening to that you're going to take back with you?
Sure. So, I've spoken a bit about the cabotegravir prep, but I guess not just only HIV prevention. There's loads of talks here about doxypep, so doxycycline post-exposure prophylaxis, kind of taking this antibiotic doxycycline within 72 hours of having sex to prevent STIs. So we haven't got that in the UK yet under our kind of guidelines, but I think it probably will come to us eventually. So kind of learning about what's happened globally and the pros and like the reduction in STIs that have been seen, particularly gonorrhea, chlamydia and syphilis, but then also kind of learning about the risks as well in terms of antimicrobial resistance. So I hope I'll be able to kind of take that knowledge back with me and kind of future better advise our clinic, keep us up to date on all the kind of recent findings from here.
Why do you think that is important to you, maybe, to bring some of those back to the community?
I think because I'll be the one who will be in a position to implement it, so I'm kind of the lead for PrEP in our clinic, so I feel like anyone who's on PrEP will probably be eligible for doxypep, so they will kind of go hand in hand. So if I can learn about doxypep now, then whenever it does become available in the UK, I'll be able to kind of quickly implement it and kind of advise on best practice and the most recent data and literature around it.
Man, that's fantastic. And what is, are you involved with anything that you might want to mention?
I guess there's just one thing which I've been trying to develop in the UK. So there's kind of lots of pharmacists involved in PrEP, quite a lot of the time as a bit of a side to their kind of main role. So their primary role might be like HIV or infectious diseases, and PrEP is a bit of a side thing. But I want to kind of promote the role of pharmacists in HIV prevention. So I've developed a PrEP pharmacy network in the UK where we've now got over 100 members, which is amazing. And we meet kind of every quarter virtually and discuss kind of ongoing issues with PrEP, whether it's like stock problems or implementing national policies, new drugs in the pipeline, and kind of collaborating on research projects or quality improvement, service design things. So I would love to kind of broaden this out more globally and reach, kind of speak to pharmacists involved with PrEP anywhere around the world. So I've been lucky to meet a couple of pharmacists here at the conference, which has been amazing. But I guess if any pharmacists are involved in PrEP, I would love to speak to you. So yeah, I'll give you my details, and yeah, please get in touch. That would be amazing.
Yeah, okay, yeah, well, I'll definitely put that in the bottom links for everyone to check out. And the future, 2024, what are you looking forward to after this meeting, speaking with others amongst your field?
Yeah, good question. So a bit of everything, really. I think we've come so far in HIV. A lot of the countries have kind of met the UNAIDS kind of 90-90-90 target, which is having 90 people aware of their diagnosis, 90 people on treatment, and 90% virologically suppressed. So kind of the next thing is to have 0 new HIV infections by 2030. So how we can kind of, how do we do that? And I think PrEP is one of those things, and to kind of better improve access to PrEP for starters, and access those more marginalised groups, and getting cabotegravir injectable PrEP out there. Those are my kind of three main take homes.
What would you say is one hiccup maybe preventing those things from happening right now?
So I think there's difficulty accessing sexual health clinics. Particularly in the UK, we've had a lot of like budget cuts happen. As everyone has, dealt with COVID, we've had the monkeypox pandemic, and that's kind of burdened our services. But yeah, we've basically got funding going down, but the STI rates are going up. So how do you kind of tackle that? So kind of thinking a bit more out of the box. So we're trying to do maybe more like virtual appointments.
Okay.
So that patients don't have to come into clinic. How can we manage that virtually, doing like postal prescriptions or using kind of the home online testing kits. Basically, reaching as many patients as possible. And kind of optimizing our skill set as well. So we're lucky we've got like pharmacists, nurses, health advisors, doctors, healthcare assistants in sexual health. So kind of optimizing all staff available seeing patients. But we're doing that and maxing out capacity, and we're still not like meeting our targets, from our commissioners. We're not, meeting the needs of our population. So we're kind of having to think novelly, virtually, doing apps, that kind of thing. So yeah, you kind of have to be a bit more innovative these days.
Yeah. What's one thing that you're going to take back from this meeting that you're really looking forward to bringing back to your community, though?
I think, yeah, there's loads. Learnings from doxycycline PEP, learnings from implementation of cabotegravir, injectable PrEP. I would say the two main things.
Fantastic. Thank you so much for taking the time to speak with me.
Thank you so much, Jacob.
See ya.